In the third part of this module, I will discuss some approaches for analyzing the health knowledge economy. The first step is simply to make a map of all the different actors that are playing a role. For example, we need to list all the providers of information, of advice, and of drugs, which are all relevant to outpatient care. We need to describe the flows of information and of influence to service providers and to the public. So, for example, which different population groups derive information and advice from different sources. We need to analyze the roles, the interests, and the influence of different stakeholders. And these include private companies, they may include citizens groups, and they clearly involve the regulatory arms of the state. We need to document the formal regulatory rules and the informal rules that influence performance, and also the behavioral norms of what is right and what is wrong that also influence how the suppliers of or the actors in the health knowledge economy perform. And ultimately, we need to assess alternative pathways of development. So what might this involve in practice? Well, we can start by simply asking, where do people get information on pharmaceuticals? Well, many people get advice from family and friends, but they then will have developed their ideas from somewhere else. They may consult a health worker, a doctor, or an informal health provider. The government provides health information. With the spread of access to the mass media, commercial advertising is playing a growing role in many countries, so people get information from that source. And there are a whole number of local knowledge intermediaries who collect expert knowledge and provide access to it for their clients. This may be community health workers who are trained specifically to undertake this role. They may be drugstores or retail pharmacy chains who not only provide drugs but access to advice. And there are a number of new knowledge intermediaries. There's mobile phone companies who provide a number of services, either SMS text messages or consultation lines. There's websites on the internet and other sources of health-related information. So people can go to a number of places to find this information. Where do service providers get information on pharmaceuticals? Well, first, if they've been formally trained, they will have obtained information from the training institutions. Their professional bodies provide information, and government may provide advice. They also will be getting recommendations by colleagues. In addition, the pharmaceutical manufacturers and distributors of drugs produce advertising to influence providers, and they may also send out drug detail men to visit providers and maybe to provide financial inducements to supply and sell more of their products. And there are other knowledge intermediaries, again, mobile phone, mHealth services, the internet, and so forth are becoming increasingly important sources of information for them. And there's commercial advertising on the media. So as you can see, both the users of pharmaceuticals and the suppliers of pharmaceuticals obtain information from a number of sources. Well, we need to go beyond simply the sources, and we have to ask, what factors influence drug prescribing? First, if people are buying drugs, those selling them may earn a profit from those sales and have incentives simply from direct financial incentives. Often the suppliers of pharmaceuticals will provide bonuses or kickbacks to the retail sellers of their product to supply more of them. The reputation of providers of advice and services is also important. And there are a series of formal and informal rules and also norms of behavior that influence drug prescribing. We need to understand all those if we're going to design an effective intervention. What might interventions be to influence the health knowledge economy? Well, the first and most obvious is to enact laws and then create a capacity to enforce them. Already there are a whole series of regulatory rules in most health systems, but this changed health economy may need different laws and different capacities to enforce. Professional bodies and trade associations can take action to establish norms of behavior. We need measures to address issues of interests, ownership, and power. For example, many countries forbid close economic relationships between doctors and providers of services and drug sellers to provide excessive incentives to sell more drugs. In other countries, there may not be these rules. And as mobile phone companies and other knowledge intermediaries become increasingly involved in the health sector, there may be new forms of conflict of interest that need to be addressed. We need mechanisms to provide information to the public. Government needs to build its capacity to influence this health knowledge economy, and the membership of different sorts of regulatory partnerships will strongly influence outcomes. And there's possibility for agreement on global standards. I want to end this module by raising a few issues that you may think about the growing opportunities of the health knowledge economy and the growing challenges. First, should governments regulate the health knowledge economy? And what aspects should they focus on in the near term and the longer term? And more challenging question, how can governments regulate effectively in a context of the changing information technologies, the spread of markets and the changing health markets, and deepening globalization? These are issues that we will be addressing increasingly over the next few years.